Hi, parents. I'm Shirley Schaffner, and I am privileged to teach your students in um, Practicum in Health Science. I've had the privilege of teaching many of these students in previous courses, and so it's good to have them back again. And I'm so delighted that we're able to be on campus this year. It's so good to see the kids. I would like to share with you just a few things about the course. Uh, and so I'll give you a bit of information. Some of you we've already met before. My name is Shirley Schaffner. I have a Bachelor of Science in Nursing from Texas Women's University and a Master's in Business Administration from the University of Dallas. Over a period of time, I've had the privilege of serving as a registered nurse, as a hospital administrator, and also in 2016, I was licensed as an EMT. So as we proceed through this year, I hope to be able to share with your students a number of opportunities that they may want to think about pursuing as they get ready to complete this year, which I hope will be an exciting one for them, and move on to the next phase of their career. This is Practicum in Health Science, and these are pictures of our students in a previous year in healthcare theory and practice, preparing them for what is coming, which is really exciting. And that's getting out into the actual uh, field of practice for medicine, observing professionals in their environment and participating in patient care. So the focus really centers around these two opportunities for doing that. The pharmacy rotation will start October 18th and will end December 6th. Students are really excited about getting their uh, pharmacy assignments next week. And then we are doing a really intense preparation to try and get them all the technical skills that they will need as they go into the pharmacy. Uh, in the spring, we will do our clinical rotations. Your students will be finding sites for that. We'll start the 28th of January, which gives us some review time and some preparation time. And then we'll be back in the classroom after spring break to prepare for their farm tech exam. This year, that exam will be taken off site at the Pearson View testing locations. And as we get closer to that, I'll have the students go ahead and register to take the exam, and then the instructions as to where and when will come as they do that. So, students are required to find their clinical sites, and as soon as I get our pharmacy assignments done, then I will be sending to you and your students the instructions for securing a clinical site. We'll start that process on the 4th of October, and hopefully your students already have in mind what they'd like it to do. We don't have a list of sites that are available for students to choose from. They will have to go and make contacts and search for their sites. I'll do everything I can to help them in that. I've already communicated with a number of our partners who uh, take students, and they're willing to take students this year. Uh, so hopefully that continues to be the case as we move on, and our students will have opportunity then to observe professionals actually in practice with with patients and participate some in that. Uh, we use the standard methods right now. While we're learning our basics, we're doing mostly lecture discussion worksheets and some uh, hands-on labs to practice some of these skills. I'm trying to uh, have them checked off with proficiency in vital signs before they go to the pharmacy. And I'm also working on getting them certified in uh, basic life support CPR. So I'm working on those arrangements, and we'll let the kids know when I'm able to do this. Grading policies we explained in the syllabus. Um, we decided this year, since our students were coming from a year of many attending virtually, and they'd had access to all of their notes for exams, which honestly had been helpful to them, that all of our grades would be equal this year as they begin to uh, study for exams that don't have notes attached to them. This gives students that sometimes don't do well on exams opportunities to demonstrate proficiency in the skills in other ways. All assignments are listed are to be turned in to Schoology. I've reduced the number of assignments that I'm grading this year to give the students a little flexibility in creating them. They, however, will have to demonstrate that they've done the assignments on their exams or they simply cannot pass the exams. Late and missing work policies are outlined in the syllabus. We did make some changes to allow for a little flexibility this year, but the students absolutely have to do a much better job this year in being disciplined about turning in assignments. Tutorial times are listed on the syllabus if our students need that. Um, and guys, I'm just looking forward to our with our students to a really safe and successful year. It's so exciting for me to watch them go into these clinical areas and perform at a very high level, and then celebrate with you and with them uh, their graduation in May. Um, again, I'm delighted to have our students back in the classroom, and I do encourage you to reach out to me if you have any concerns whatsoever. I'll be glad to respond to you or to answer any questions that you might have. Thank you for your time. Look forward to working with your students and interacting with you um, as we have opportunity. Thank you very much for your time.